Sound check one. Good morning, everyone. Welcome to the Public Health Committee meeting. I'd like to call the meeting to order. Remind everyone that electronic devices are to be switched to a non-audible function during committee meetings. Quorum is present, and within the chamber here we have Councillor McMeekin, Councillor Wang, good morning, Councillor Wilson, Councillor Kassar, Councillor Beattie, and joining us electronically we have Councillor Jackson, Councillor Danko, Councillor Francis, and Councillor Kretsch. Good morning, everyone. Madam Clerk, are there any changes to the agenda?
No, Madam Mayor, there are no changes to the agenda.
All right, then. May I then have a mover and seconder, please, to approve the agenda as presented? Moved by Councillor Wang, seconded by Councillor Kassar. I'll take a quick vote. We're all here bright-eyed and bushy-tailed, but maybe not the system. Oh, there we go. Okay, that's carried 10-0. Thanks very much. Let's see. Are there any declarations of interest? Good morning, Councillor Pauls. Any declaration of interest? No? Seeing none then? We'll go on to the approval of the minutes of the previous meeting, January 15th, 2024. Can I have a mover and seconder, please? Moved by Councillor Beattie, seconded by Councillor Pauls. That carries 11-0. Thanks very much. Communications. Can I please have a mover and seconder to put the communications item on the floor? Councillor Alex Wilson, thank you. Councillor Kassar. Is there any discussion on the communications items? Good morning, Councillor Wilson. Seeing no discussion then, we'll go to the vote. It's you, not the system. I jinxed you by saying a quick vote. We'd have a quick vote, first one. That carries 12-0. Thanks very much. We're now going to go on to a staff presentation 8.1, the 2024 Annual Service Plan and Budget and Public Health Priorities, BOH 24001 citywide. So Dr. Richardson and her team are going to be making the presentation. Dr. Richardson will be at the podium, and the rest of the members of the team are going to chime in from the bench, just because there's about 4 others that Dr. Richardson will be relying upon: Director Vickers Menzin, Director Prieto, and Director McDonald. And so instead of crowding up the podium, making everyone uncomfortable, they can have the luxury of sitting in their seats as we go through the presentation. So please go ahead, Dr. Richardson.
Thank you very much, Mayor. So this morning we're very happy to present to you our 2024 Annual Service Plan and Budget, as well as focus in on our public health priorities as part of that plan. So you've seen this once before, but it was just after you'd taken office, so this will be your second time around seeing the overall plan that we do. We have to submit to the ministry every year a full plan about all of our programs and services, and part of what we present to them as part of that and to yourselves is our community health status information. So this is some of the updated information. What you're going to see today is the beginning of what will be the community health status report that will come back to you in June. So there'll be more information, more detail that will come back to you then. I'm going to go through a little bit at a high level for the whole city, and then you'll see as each of the directors goes through the priorities, a bit more detail going into each of those areas. Then we are going to have each of the directors that's leading one of the priority areas go through and talk about the population health needs, how it aligns with council priorities, and then at the end look at the budgeted expenditures for this. And those are no different than what you see in the overall city budget. They're just done up in a slightly different way for what you see for the ministry-funded portion of the Ontario Public Health Standards. Just before I go forward, though, I do want to just thank a number of people that have been instrumental in putting this together. So those are the directors that you will see up here today, but also all the managers. They have to do a lot of work. There's a lot of detail. It's a massive document. It's not even printable, actually, anymore because of the kind of scope and size that it is to go into the province. So all of them have been hugely important in developing this. Our epidemiology and evaluation team have been very critical in pulling together all those stats and helping us crunch the numbers, not just for what you'll see here on the community health status piece, but also for the key performance indicators that we use every year to look at how we're doing and what we want to accomplish in the coming year. And as well, our planning and competency development team who, along with our finance and admin folks, do crunch the numbers and put it together and liaise with the province to make sure that we have what they want. They generally send us a template very late in the year, and so they're quickly adjusting to make it all work according to what they've asked us to provide. So overall, you'll remember too that there are these 4 foundational standards that we do work under. So population health assessment, health equity, effective public health practice and emergency management, as well as 9 program standards: chronic disease, food safety, healthy environments, healthy growth and development, immunization, infectious disease and communicable diseases in both prevention and control, safe water, school health, and substance use and injury prevention. These are the standards, which I'll talk a little bit more in a moment, that they're in the process of reviewing. And these laid out detailed requirements of what we're to do in each of the program areas. Today, I'm going to focus in on the priorities, we're not going to go through every single one of those. So as we were developing this, you might recall that we came in November of last year to talk about how we would be putting this together, knowing that it was a really tough budget year, very tough financially, and that there was a lot of change that was happening from the ministry's perspective with this idea of strengthening public health and what they were planning on that from that standpoint. And we also wanted to look at our core public health functions then and mandates, the council priorities that come forward, as well as the population health needs that come from that community health status information. So we really focused on a few things. One was strengthening program efficiency. And so we did do, as you'll see in your report, we did do a review of one of the programs more in depth to look at what we might do there. We also look at how we can strategically allocate our resources so that we can absorb much of that respiratory work that has been going on over the last 3 years or so into our programming, as well as the vaccination work that we were doing. So just to give you a sense of what that meant for us. In any given year, we would normally have about 120 to 150 outbreaks that staff would be managing. In the last respiratory season, we had 350 outbreaks in 2023. So, 2 to 3 times what we would normally experience. From a vaccination standpoint, we do vaccination in schools. We've done that all along for the grade 7 and 8 vaccinations, but influenza vaccination for us had dropped off long ago. When the province had allocated vaccine out to the ministry, or out to the pharmacies, it had been very successful. And so the uptake in our vaccination clinics dropped from about 25,000 people a year down to 6. And at that point we said, 6,000 had dropped down to about 6,000, and so we started looking at, what should we do, and all of them were declining. It wasn't that there were any pockets, and so we eventually closed those vaccination clinics down. Now we're back at it. We're doing between 100 and 140 vaccination clinics per year, mostly out in the community in our equity, targeting our equity deserving groups, as well as those who are most vulnerable and in need of vaccination. So that just gives you a bit of a sense of what we've been doing to, what we've had to absorb into the work, as well as look at what we're doing so we can strategically allocate resources to where there's needs. Along the lines, when it comes to serving those equity deserving groups, we've been looking at piloting a program where we are taking out our integrated services into the community through some public health service centers and engaging with communities and partners on what those needs might be, and working particularly right now with our primary care colleagues who are doing some work at Eva Rothwell, and what could we do as we move forward on that front. The other thing is realigning our core services that serve out to our programs and looking at, what are the best practices, what needs to happen, and where's our public health role going. And so we've heard from the province in particular, they want more in terms of emergency management, they want more in terms of communications work, they want more in terms of immunization work, and so we've been looking at how do we resource those things. So what you're seeing here today and what you see in the budget that at committee at GIC, it reflects the changes that have been made. There's no new news on that front here today, but it's explaining where it is and what we're doing.
Excuse me, because
I'm sorry. Hold on. I'm sorry. There's no participation from the community. If you want to provide some kind of feedback, you can do that in a separate forum. Excuse me, please. We have a presentation. We have to get through the presentation. The presentation will be available and the staff report actually online. If you'd like a copy of the presentation or the staff report and you can't get it online, we can certainly arrange to have that sent to you. So we'll just leave your information with our clerk before you leave, and we can get you the information. I'm sorry, we're going to have to go on to the presentation. Thank you very much. Go ahead, Dr. Richardson.
Thank you, Mayor. So I'll just remind you about the province's strategy and some of the key points in the timeline that we're going to be experiencing as we go forward. So in the red boxes are the ones I particularly want you to focus on. So in the fall of this year, we're expecting the release of the new Ontario Public Health Standards. So they've been working on them, making revisions. We've seen some of those at staff working groups and where they're going with them, but it's all got to be brought together, and they're planning to have that brought to us by this fall. And that's so that the planning can align with the development of the budget for 2025. They know that's important. The effective date, though, will be January 1st of 2025 based on what they've told us today. From a funding perspective as well, there's some key pieces to note. So you'll recall that they had implemented some short-term stabilization funding, which meant that they restored our funding to our base 2020 levels, and they've introduced a 1% growth annually until 2026. In the meantime, what they're doing is looking at the funding formula overall and the funding approach, and they're expecting by spring of 2025 to be communicating a new approach to funding for these programs and services, and then implement that in 2026. Just one last note as well is about when we talk about evidence, a lot of people tend to think that we're talking about research evidence. And yes, we are. When we look at we do look at the research to see what's the most effective way. Do things actually make a difference in terms of public health actions that we can take? Sometimes it's frustrating because we have things that we can, there's nothing we can do about things as they increase or whatnot. And so we want to make sure we're not doing things that don't make sense. And so we look at that research evidence to see, okay, what can actually make a difference for our community? But equally important is that community health status information and the statistics and whatnot that you'll see, the community's preferences and political preferences about what it is that we think this community needs, and who can serve it well, and the existing resources and assets that are here. So we strive very hard not to duplicate what others are doing. So if somebody's already out in the community delivering a service, we're not looking to duplicate that, but rather looking at how could we partner if need be and how to move some things forward. So all of that goes into both these priority actions that we develop, but also for every single piece of programming that we do. That's the work that the managers do. So this is the first parts of our health status information that my EPI colleagues and the managers have been talking about. As I said, you're going to see a full report on this come through in June. One of the interesting things that we're doing between now and June is going out and meeting with a number of different groups, going out and meeting with racialized groups, going out and meeting with equity deserving groups that may have come from poverty or other areas. We're also meeting with the health system partners to talk to them about what this looks like for them and what does it mean for them. So we're doing that over the coming months, and you might hear a little bit more about it as we go through that. Essentially, too, I want to flag that as I go through this, you're going to see me use terminology that reflects the way that data was collected. So this is all data that was collected by somebody else, usually the census or some sort of health status piece. So when we talk about gender or we talk about different things, I have to use the language they've used. It's one of the things as we go out and talk to our partners and talk to the community about it, we'll be talking to them about those sorts of issues too, in terms of making sense of all of the information. So Hamilton, 5th largest of all Ontario municipalities. Our 2023 population is at 605,000. Our projected 2046 population is at 809. So a growing population. But there's been some changes to demographics as well, and you've heard about this through the budget process as they talked about these things at the housing presentation, but there's been increasing houselessness. So our monthly range used to be 864 to 1,105 back in 2020, but now it's 1,465 to 1,985 as of the last year. An increasing proportion of Hamiltonians are identifying as racialized. So it was estimated that there were 25.1% identifying as racialized in 2021 compared to 15.7% in 2011. And for the first time in recorded history, our population has more seniors than children and youth. So those age 65 and over make up 18.4% of the population in 2022 compared to 17.3% in 2018. By contrast, those that are aged 15 and under have decreased a little bit from 15.8% in 2018 to 15.4%. We talk about leading causes of death, and when we look at these, the top 5 leading causes haven't really changed all that much. But I'm going to take you first to the left-hand side of the chart. So when we talk about life expectancy, overall, our life expectancy in Hamilton is at 81.3 years, which is over a year less than Ontario as a whole, which sits at 82.6. Females do continue to outlive males, and so males are living 78.8 years and females 83.6. Both of those are lower than for the province as a whole. As I said, the ranking for the top 5 leading causes of death didn't change between 2012 and 2021, but the top 5 those causes of death have changed a little bit further down. I'll come to that in just a moment. So ischemic heart disease, dementia and Alzheimer's disease, cancer of the lung and bronchus, cerebrovascular disease, and chronic lower respiratory diseases are the major causes of death. The rate of deaths, though, has increased from 809 in 2012 per 100,000 to 907. And part of that is because people are getting older. Part of it, when you look at just sheer numbers as opposed to rates, is our population's getting bigger. But as well, it is those things that are just below these top 5 that are driving that as well. So coronavirus disease became a 10th leading cause of death over the last few years.
Excuse me, I've already asked once. The way we do things here is we don't interrupt when there's a presentation on the floor. So I'm going to ask you to please remind everyone, actually, not just you, everyone, that we want to have a respectful meeting today, and that any disruptions that happen are going to extend the length of our meeting. And so just please remember, any comments come through the chair. People around this table know that. But comments from the from the gallery while there's a presentation on are disrespectful and not acceptable, so thank you. Please go ahead, Dr. Richardson.
The other key thing that's driving that increasing rate of deaths is unintentional poisonings. And you can see that it moved from 28th spot in 2012 up to 7th in 2021. This now takes those deaths and talks about the particular subset that are premature deaths. So everybody in Hamilton should be able to live to the age of 75. Doesn't sound like, you know, a very old age these days to be considering those younger than that as being premature deaths. The rate of premature deaths, though, per 100,000 has increased from 314 in 2012 to 369 in 2021. And again, that's largely due to the unintentional poisonings and COVID. When you step through that graph, you'll then see that we break those down into avoidable deaths and unavoidable deaths. So avoidable deaths are those premature deaths that could have been prevented through either preventative things like lifestyle changes, smoking, those sorts of things, or through treatment that would have occurred before the age of 75. And then when you take those avoidable deaths, we've broken them down into those two categories. The other thing that is key is that the rate of premature deaths is not equal for everyone. So that inequality has also widened over time. So Hamilton's neighborhoods with the greatest proportion of low-income households experienced a premature death rate of 175% or 175% greater than neighborhoods with the lowest proportion of low-income households. And nearly half of premature deaths actually could have been avoided overall through prevention efforts. So there are some things that are improving overall when we look at our health status snapshot, and there are some things that are getting worse. So in the improving category, the rate of ischemic heart disease is still high in Hamilton, remains higher, but our death rate is going down. It's decreased from 2016 to 2021. The rate of hypertension or high blood pressure and chronic obstructive pulmonary disease are also improving between 2011 and 2020. Teen pregnancy rates are down, as is tobacco smoking initiation, all down, which are great. But overall, we do have some things that are worsening. And when I talk about mental health and substance use things that are worsening, there's a fair number of them. We've talked already about opioid-related deaths and unintentional poisonings. Cannabis-related emergency department visits. Vaping among the youth has gotten worse. Self-harm among youth has gotten worse. Child and youth outpatient visits have increased, and perinatal maternal mental health has worsened. At the same time, on the infectious disease front, we've seen those pressures of the seasonal respiratory illness happening in the community. Those numbers have been up, of course, in part driven by coronavirus and COVID-19, and as well syphilis has been up, and Lyme disease has also been up. So we're going to go through now the public health priorities that have been identified based on all of that information, those 4 quadrants that we've talked about. And there are 4 priorities that we're addressing for the coming years that align as well with council priorities. One of those is health equity. Child and youth healthy growth and development is the second, mental health and substance use, and climate impacts. And you'll say to me, those don't look so different from 2023. And you're right, they're not. They are essentially the same as they were last year because these are the enduring issues that our community faces. And so we don't have a lot of change that happens year over year. But what you will see in your Appendix B to your report is the work that we've done over the course of 2023 to address these. And then each of the directors will go through in detail the things that we're looking at to go forward. Just wanted to orient you a bit. You're going to see a lot of data in a few minutes and a lot of detail, a fair amount of detail. You're going to go through each of the directors that will go through a priority. We'll go through that community health status information like I just did, talk about how it aligns with the standards, talk about how it aligns with council priorities. They'll talk about the specific action areas within each of those and the objectives that we hope to accomplish over the next 1 to 4 years. So I'm going to ask clerks if I can turn off my mic. Can I do that here, or you have?
I'm going to
turn it over first to Jen Vickers-Manson, who's our Chief Nursing Officer and Director of Healthy Families, and she's going to take you through the health equity priority as well as the healthy growth and development priority. Jen.
Thank you, Elizabeth, and good morning, everybody. It's my great pleasure to present the initiatives and efforts that we will be undertaking this upcoming year and for the next few years related to health equity. So as Elizabeth outlined for you, I will start with some of our community health status information as it relates to health equity. And as you all know, there are many factors that drive health inequities in Hamilton, including income, education, racialization, family structure, and housing. So when we look at those numbers, I'll just ask you to go to the next slide, Elizabeth, if that's okay. Thank you. Compared to Ontario, Hamilton has a higher percentage of residents with less than a high school education, a higher percentage of residents that are lone parent families, as well as a higher percentage of residents and households in core housing needs. In addition, compared to Ontario, Hamilton has a lower percentage of residents living in poverty, and you can see the rates there in brackets, so 7.7% in Hamilton versus 8.3% in Ontario, and those identifying as racialized, a lower percentage in Hamilton compared to the province, again, 25.1% in Hamilton versus 34.3% in Ontario. In addition to this, there's various health risk factors that are disproportionately experienced by Hamiltonians. For example, 17.1% of Hamiltonians aged 20 plus smoke tobacco, which is higher than the provincial average. In Hamilton, tobacco use is higher among adults with no high school diploma, lone parents, and LGBTQ2+. 44.1% of Hamiltonians report their activity levels as below the physical activity guidelines, which is similar to the provincial average. Low physical activity levels are significantly higher among Hamiltonians who have low income, are racialized, and are adults with no high school diploma. 44.5% of Hamiltonians report one or more metabolic conditions, which are issues like high blood pressure, high blood cholesterol, osteoporosis, or diabetes, which is similar to the provincial average. Metabolic risks are significantly higher among Hamiltonians who have low income and are adults with no high school diploma. Students from families with a low income reported going hungry more frequently than students from families with a high income. So in addition to highlighting the health risk factors, what we're trying to demonstrate is who in our community is disproportionately impacted. In addition to this, among health outcomes, substance poisoning, assault, sexually transmitted and bloodborne infections, diabetes, and self-harm have the greatest inequalities in Hamilton. Next slide, please. In this slide, we relate our PHS health equity priority to the Ontario Public Health Standards. The priority goal related to the Ontario Public Health Standards is that public health practice results in decreased health inequities such that everyone has equal opportunities for optimal health and can attain their full health potential without disadvantage due to social position or other socially determined circumstances. You'll see here 4 boxes. These represent our 4 action areas that Public Health Services plans to focus on to improve health equity, those being competency development, data for equity, community collaboration, and demonstrating impact. Overall, this priority is aligned with the responsiveness and transparency term of council priority. The specific outcome it addresses includes prioritizing customer service and proactive communication, involving more people in decision-making and problem-solving, and building high-performance public service. I'll take you to the next slide where I'll go over each of the action areas and outline Public Health Services goal. So again, our priority action area for competency development, our action area goal here is to enhance staff competency to improve equitable outcomes in programs. Our next priority action area is data for equity, and our goal here is to enhance the collection and use of data on the social determinants of health for Hamiltonians. Our next priority action area is community collaboration, and our goal here is to increase engagement with priority populations in identifying and addressing health inequities and collaborate with community partners to co-design and implement strategies to address those issues. Our last priority action area is called demonstrating impact. And our goal here is to measure and demonstrate the impact of programs on health inequities in our community. And our next slide will break these action areas down further and just identify the objectives that we are targeting for 2024 and beyond. So under competency development, I won't reread the goal, I'll just focus on reading the objective. Through 2025 and beginning, we are going to promote an organizational culture that increases health equity competence by providing training to and setting behavioral expectations for all staff. Through 2024, we will provide Indigenous cultural competency training to 55 additional staff, where we will better understand and apply our local context in order to build meaningful relationships with our Indigenous communities. Next slide, please. This is our data for equity goal, and our specific objectives are outlined here. There are three. The first one is through 2024, we'll provide 100% of programs with equity-focused population health assessments to guide the development of targeted services. We will also focus on health equity key performance indicators and enhance our social determinants of health data collection. Next slide, please. There's one objective to address data for equity action area, and it's really focused on through 2027, we are going to increase our engagement with priority populations to emphasize and build trust about the integration of lived experience into our programs. And finally, there's also one objective to addressing demonstrating impact. And that is that we're expanding our monitoring and reporting on priority populations that programs reach. And just to give a little bit more context here, many of the programs that we offer have eligibility that are targeting those who are disproportionately impacted. So for example, our dental programs focus on low-income individuals. Our Healthy Babies, Healthy Children home visiting program screens those at risk related to the social determinants of health. But what we would like to improve on is, of those who are eligible for our programs and screened in, who are we servicing and who are we missing, and how can we further tailor our program so that we are ensuring that we're reaching those that are the most vulnerable. I'll take us to our next PHS priority, which is Child and Youth Healthy Growth and Development. In the next slide, I'll take us through the health status highlights, starting with relevant community-based status and considering children and youth social circumstances. Just want to highlight 13% live in low-income households, which is higher than Ontario. 10% are in core housing need, which is higher than Hamiltonians of all ages. 21.7% of students report going to bed or school hungry. This is lower than Ontario. From a mental health and substance use, what we're seeing is increasing needs and pressures, reflected in 29% of students grades 9 through 12, only reporting fair to poor mental health. This is similar to Ontario. And 1 in 8 students reporting seriously contemplating suicide. This is lower than Ontario. 28% of Hamilton mothers had at least one mental health concern during their pregnancy. 8% of kindergarten students and 9% of grade 2 students required urgent dental care. This is lower than our pre-pandemic numbers. And then the percentage of students with a vaccine record continues to be lower compared to pre-pandemic, and this is being seen province-wide. The next slide takes us to how do these priority action areas relate to the Ontario Public Health Standards. And so you can see our Ontario Public Health Standards. There's two different program standards that include healthy growth and development and the school program standard, which makes our priority goal for child and youth healthy growth and development to achieve optimal preconception, pregnancy, newborn child, youth, parental and family health, and to achieve optimal health of school-aged children and youth through partnership and collaboration with school boards. You'll note 3 action areas that we've identified here, which include optimal prenatal health, infant early years mental health, and optimal health of school-aged children. You'll also note that there is no identified alignment with the term of council priorities for this priority area. I'll now go over each of these action areas with their goals. So just noting optimal prenatal health, our goal is to improve health and mental health during pregnancy and immediate postpartum. For our infant and early years mental health, it's to reduce the number of children aged 0 to 6 at risk for poor social and emotional development. And in the priority action area of optimal health of school-aged children and youth, our action area goals are to, in partnership and collaboration with school boards and schools, improve the mental health and well-being of school-aged children and youth, increase access to oral health care services for children and youth, and reduce the burden of disease in the absence of school due to lapsed Immunization of Schools Pupils Act. Now I'll go into a bit further detail around some of the objectives that will carry us through 2024. So under our action area of optimal prenatal health, we want to increase the use of prenatal supports among individuals with poor perinatal mental health and other prenatal risk factors. In infant and early years mental health, our objective is to improve the coordination of screening and to identify children at risk and connect families as early as possible. Carrying on to the optimal health of school-aged children, you note 3 objectives. One is related to the number of priority school communities that report positive impacts on student health and well-being. The other is to increase access to preventive oral health care, and the last being to increase vaccination rates among students enrolled in Hamilton schools. Thanks for the opportunity to highlight those priorities and your patience while I went through that level of detail. I'll now turn it over to Julie Pareto, who will talk about mental health and substance use.
Good morning, everyone, and thank you, Jen. So today I'm delighted to be sharing details surrounding our mental health and substance use priority. So mental health and substance use disorders often co-occur and share several risk factors experienced in the early years that may impact emotional and social development. 16% of Hamiltonians over 12 years report mood and anxiety disorders. This is higher amongst females, those aged 20 to 44, and those that have a lower income. Intentional self-harm emergency department visits are higher in Hamilton than in Ontario, and again higher among females aged 10 to 19 years. When we look at substance use, based on most current data, over 1,000 local deaths are attributed to 3 substances, that is alcohol, tobacco, and opioids annually. Hamilton's opioid-related death rate was 63% greater than the provincial average in 2022 and was higher than the rate in most provincial health units. In Hamilton, the rate is higher amongst males aged 25 to 64 years. And further, while most opioid-related deaths in Hamilton occur among people living in private dwellings, the number of deaths per person is higher within the smaller community of Hamiltonians experiencing homelessness, resulting in a higher rate of deaths within this group. So this priority is related to the Substance Use and Injury Prevention Program standard within the Ontario Public Health Standards, where our priority goal for mental health and substance use is to promote community mental health and well-being and reduce the burden of substance use. Public Health Services is contributing to improving mental health and mitigating the impacts of substance use by focusing on the following 4 priority action areas. So the first is trauma and violence-informed care. The second, youth mental well-being. The third, municipal policies on substance use. And finally, our 4th area is harm reduction. This priority aligns with both the safe and thriving neighborhoods and the responsiveness and transparency term of council priorities. The specific outcomes it addresses of the safe and thriving neighborhoods priority include providing vibrant parks, recreation, and public spaces. And the specific outcomes it addresses of the responsiveness and transparency priority include prioritizing customer service and proactive communication and building a high-performing public service. So when we look at these action areas, I'm just going to go through them individually. For trauma and violence-informed care, we do aim to strengthen public health services' approach to trauma and violence-informed care. For youth mental well-being, we aim to increase resiliency and promote mental health and well-being amongst youth in the middle years. For municipal policies on substance use, we aim to enhance the municipal alcohol policy to mitigate the harms associated with alcohol use on municipal properties. And for harm reduction, we aim to enhance harm reduction education, programs, and services to support safer substance use amongst people who use substances. So we'll just look at our objectives now. So there is one objective to address the trauma and violence-informed care action area, and that is through 2025, provide 100% of services in emotionally and physically safe environments through the incorporation of trauma and violence-informed care principles. And then the one objective to address youth mental well-being is through 2024, develop a plan to address risk and protective factors among youth in the middle years. When we look at addressing municipal policies on substance use, our objective is through 2025, we will lead and coordinate the revision of the municipal alcohol policy and support the implementation of the revised policy to promote healthy, safe, and enjoyable environments. And finally, there are 3 objectives to address the harm reduction action area. So through 2024, we will update the Hamilton Drug Strategy with a focus on alcohol, cannabis, and other substances of concern to reduce the harms associated with substance use. Through 2025, we will implement the Hamilton Opioid Action Plan in collaboration with community partners to reduce opioid-related harms and deaths and increase access to treatment. And finally, through 2025, we'll increase supports for safer substance use among people at high risk of alcohol and cannabis-related harms. So I want to thank you, everyone, and I'm going to turn it over to Director Kevin McDonald for the final priority.
Thank you very much, Julie, and good morning, everyone. Kevin McDonald, Director, Healthy Environments Division with Public Health Services. I'm pleased to be able to share this morning details about our work on climate impacts priority. I want to begin by noting the intentional shift in terminology that we're using here in terms of previously talking about climate change. Instead, going forward, we're going to be talking about climate impacts when we bring this material forward to help focus and delineate the work of Public Health Services from our counterparts in the Office of Climate Change Initiatives under Dr. Lukasik. So, as we've talked about at previous meetings, Hamilton's temperature will increase.
Can you hold on for a minute, please, Director McDonald? We have the sound coming from the audience. Can we please turn off the audio that's coming from the audience, please? Thanks so very much. Appreciated. Thank you. Go ahead, Director McDonald.
Thank you, Mayor. As we discussed previously, Hamilton's temperature is projected to increase. The annual average temperature is projected to increase from 8.3% Celsius to 10.4 degrees Celsius by 2050 and to 12.5 degrees Celsius by 2080. There's an estimated 1,291 emergency department visits for heat-related illnesses for Hamiltonians from 2012 to 2021. Hamilton's crude emergency department visit rate of 18.1 was very similar to Ontario's rate at 18.8 for the 3 years combined, 2019 to 2021 reported. Important to point out that inequities exist where most visits will occur among those with lowest income and the highest housing needs. Climate change can affect ecosystems and support spread of infectious diseases such as vector-borne diseases. Again, this is not unfamiliar to committee. Lyme disease cases have increased in Hamilton since 2013, with 2023 reporting the highest number of cases seen to date. In 2023, the rate of Lyme disease for the city of Hamilton was 13.1 per 100,000 people, placing us 10th among the 34 public health unit jurisdictions in Ontario, with the highest health unit being reported as Kingston Frontenac and Lennox Addington Public Health, where the rate per 100,000 was 176.7. So turning to climate impacts, this priority is related to both the Healthy Environments Program standard and the Emergency Management Foundational Standards within, as Dr. Richardson referred to earlier, the Ontario Public Health Standards, where our priority goal for climate impacts is to promote healthy built and natural environments that support health and mitigate the existing and emerging risks, including the impacts of changing climate, and to enable consistent and effective management of emergency situations. Public Health Services is contributing to mitigating climate impacts by focusing on the following 3 priority action areas. First, vector-borne diseases. Second, extreme heat and health. And finally, emergency management. Overall, this priority is aligned with sustainable and economical and ecological development, which is a term of council priority. The specific outcome it addresses includes accelerate our response to climate change. In terms of vector-borne diseases, we aim to increase surveillance with our epidemiology colleagues, public awareness, and detection of climate-sensitive vector-borne diseases to reduce the incidence of vector-borne disease in the Hamilton community. Details surrounding the extreme heat and health action area are under development and will be shared with the Public Health Committee as part of its forthcoming heat response strategy in a couple of months' time. And finally, for emergency management, we aim to increase preparedness and public awareness to respond to threats and to climate change. There is one objective as it concerns vector-borne diseases, and that is through 2025, increase awareness of tick identification and prevention measures among Hamilton adults age 18 plus, with a specific focus on including parents. And finally, there are 2 objectives to address emergency management. The first, through 2024, support the development and delivery of risk communications to the public during emergency threats related to climate change, for example, wildfire smoke, as we experienced last summer. Through 2024, support testing and validating the city's forthcoming heat response strategy with the community partners that contributed to the design of that strategy. Again, that will be presented in a couple of months' time. So with that, I'll turn it back to Elizabeth.
Perfect. Thank you. Thanks very much. And I know that's a fair amount of detail to go through this morning, but we wanted to make sure you understood what it was, where we were coming from, and begin to get that sense of the community health status information that we're relying on and where we're going to be focusing as we go forward. So budget-wise, wanted to just note on this, we've taken the feedback about graphics, but we're still in progress in terms of getting it better and better. So now it has shading of blue, but it's a little difficult to get the degree of information that we'd like on a slide. So this is as far as we've gotten, but we're working on this piece still. So overall, our public health services budget here is $61 million. So this is everything. The annual service plan that we're talking about today is the darkest shade of blue. That biggest piece looks almost like a Pac-Man, and that represents 83.5% of the budget. Our Healthy Babies, Healthy Children protocol is actually separate and funded through the Ministry of Community and Social Services, and that represents $4 million or 6.8%. Alcohol, drugs, and gambling services are, again, a provincially funded program, although this council provides additional support to that, and that's at $2.7 million or 4.3% of our budget. Child and Adolescent Services, our Children's Mental Health Program, again, provincially funded. It represents about 4.1% as well. Residential care facilities, the work we do there, about 0.2%, and that is funded both from fees from the operators and from the levy. And then a group of other programs make up about 0.4%, and included there are things like anonymous testing, some federally supported programs for prenatal nutrition, the physician recruitment pieces, cold supplies, those sorts of things. So for today, I'm focusing on that big piece, the blue piece. That overall funding sources, as we look at the 61 million, just to break it down by the funding source, you can see about 70% from provincial funding, and from the levy about 26.3% overall. Now, looking just at the annual service plan, that's about $50 million of that 61 million. And this one particularly looks at the funding sources for that plan. So the province kicks in about $29.8 million and makes up about 64.5% of the funding. Fees that are charged for things like food safety inspections and those sorts of things, about 2.1%. For this year, we have included in this budget the additional council referred items. They're being funded from the reserve at this point, and then the city levy about 32.5%. You'll see over to the right, and I separated it out because the province did add this Ontario Seniors Dental Care Program a few years back. It is fully provincially funded, so separated it out so we could look at the proportion of base funding for the remainder of the programs. This gives you a sense of where the funding goes over the coming years, and I think you've seen this in a number of presentations as you've been going through budget. So as we talk about the potential for a new funding formula in 2026, this gives you a little bit of background as we move forward. So as of 2023, and in this I'm just looking at base funding, so all of the resources that were given to us for the pandemic response, vaccination, whatnot, they're not included here, so that we're comparing really apples to apples as we go forward. So in 2023, you'll see that the city levy accounted for about 31.2% of funding for the total budget of 43.8 million. That increases each year as we go forward. You see a small dark blue bar there for reserve funding for 2024, but increases to 32.5% in 2024, then increases to 34% in 2025. As well as 35.4%. Now, in each of those years, we do have that 1% increase in provincial funding included there. So that is included, but the levy percentage is going up because that funding falls short of things like inflation, staffing budget increases, those sorts of things. For 2027, you see a further jump for that year because we don't know what's going to happen for 2027. We've just left it as a 0% provincial increase. So depending on what they do with the funding formula for 26 and 27, it could be different, but that gives you a sense, based on what we know now, of where things might go. So just in summary, you've heard about the priority areas that we're focusing for this year, where we're taking key action. That has all been informed, as you've heard, by the community health status information that's out there. I know some of those, they can get confusing, and so I've spent a fair amount of time looking at it and going, but wait a minute, how come we have these two things at the same time? And I think that once you see the community health status report, you'll have a bit better opportunity to dive in and just look at that data and what it means for us all together. This plan itself is going to be submitted to the ministry as of April 2nd. They did give us an extension from March 1st, which was the original date, which is why we're here today, to April 2nd. And our managers are further finalizing all the detail to go in. It's given us a bit of breathing space. And then just again to note what is going to unfold over the next 3 years as the ministry goes through its plan to strengthen public health. And there's certainly going to be some impacts both on the programming side as well as on the financial side as we go forward. So that is the end of the formal presentation. We're all here to take questions that anybody might have.
Thanks very much, Dr. Richardson, and to all the directors for the presentation. I just wanted to kind of explain where I'm heading on terms of the process. We'll have questions on the presentation, then we'll receive the presentation, then we'll put the report on the floor, and we'll vote on the report. Does that sound good for folks? Okay, so let's do it that way then. I have a speakers list started. Councillor Kretsch is first one with questions on the presentation.
Thanks. I had 3 questions generally, or 3 areas of questions, and I'll start with the broadest one. There was slide 9, I think Dr. Richardson talked about poverty impacts with respects to health outcomes, and I think the number was 175%. And when I look across the city at terms of where we see a change or a shift in overall household income related to poverty, I see in 2020 we were sitting at, according to the city's dashboard, about $109,000 overall household income across the city. And then I see areas like Ward 2, Ward 1, Ward 3, Ward 4, Ward 5 that are well below that number. in the lower city. And I wonder if you could speak to what you're seeing now as a trend that's continuing in 2024. So we had that data up to 2020. Are you seeing the same trend continuing now?
Dr. Richardson?
So for today, we don't have the details that we will have in June at our fingertips because they're all just being finalized, and we want to take them out and talk with community about them and understand them and speak to them once we've had the benefit of that sense making, as we call it. So we don't have the details to dive into, but come June, we will absolutely be able to dive into that further.
Councillor Cratch?
Oh, okay, fair enough. Just drawing attention to that issue, and hopefully we'll be able to unpack it more in June with respect to how we're addressing those challenges. My next two questions, one is about promoting safer drug use. I think Director Pareto was talking about that specifically. And I wanted to ask how we are doing in terms of balancing, I think, two somewhat competing ideas. The first idea being that we're trying to provide support to quote unquote target populations. At the same time, we're trying to promote a certain kind of safer drug use, right? So there's a bit of a Venn diagram there in terms of the competition between those things. So do we have, right now anyways, a matrice or an evaluation framework or a weighted way of that we look at these priorities and say, okay, well, there's competing priorities, and this priority is more important than this priority, and so forth. I understand that they're attached to funding models, but that's my question is more about how we're balancing priorities as a public health unit.
Dr. Richardson?
I think Julie's saying you go ahead to start it
That's
off.
what I saw too.
Okay. So it's a very important point that has been pointed out about the pushes and pulls when it comes to substance use. And, you know, we heard just last month when we were talking about these issues that there's a spectrum of substance use, and that there are certainly those who use them from a recreational standpoint. There are people who are using them every day. We're talking about alcohol, we're talking about cannabis. There's certainly people who aren't having any health impacts related to that use. However, there are those that are having significant health impacts and deaths and mortality related to them. And we see that with the opioid deaths because in large part due to the poisoning of the drug supply and all of those issues. But alcohol is actually our one that actually has the highest rates of death and illness associated with it. And so there is this spectrum and these challenges when it comes to substance use. And you know, I'd say alcohol is the one for which the evidence and understanding the impacts is the best developed. And so that one it's one of the reasons why we want to return to talking a little bit more about alcohol and where we can go about it and looking at things like the municipal alcohol policy. That has probably one of the better comprehensive strategies. Tobacco certainly has a really good idea. You know, the research has been done, what actually works to bring those down, and, you know, need a little bit of different elements of healthy public policy and smoking cessation and all those things. When we go into things like opioids, when we talk about things like cannabis as it's emerging, we don't have as well developed strategies and ideas about how much of each thing do we need to use to address this. And every community is struggling with the same things. We belong to several partnerships across the country that are regularly talking about these things and where do we go. And we, you know, in preparation for bringing back the piece about the shelter plan, we again asked, has anybody developed a framework? Because things come up, you know, month to month sometimes, and there aren't good comprehensive frameworks that are out there to address it internationally, not just nationally here in Canada. So all to say, the long-winded answer to Councillor Cretch's question, which is there is nothing that comprehensively brings it together. There are some frameworks that are better for certain substances about making that balance with things. What we do know is generally moving away from criminalization assists and reduces the harms that have been associated with it. At the same time, we need to balance respecting that some people may choose to use these substances and can do so safely and recreationally, and other people will have health impacts, and we have to figure out how to work with individuals and with communities to reduce the likelihood of those impacts happening. So it's a balancing act that is better understood for some substances and very much a work in progress for others.
Councillor Cratch, did you have one more, or was that it?
I did have a third question. Yes, I have one more. Thanks for your answer. I think that it is a really difficult thing to do. And I think that having a clear sense of how we're prioritizing the different competing parts of this, especially when it comes to the opioid crisis, is important. My last question is about pest control. So I really would like to just have a better understanding in just a basic way from you, firstly, about how our pest control program relates to municipal law enforcement. Like, I understand that public health is running programs with respect to pest control from a bylaw perspective. I think it's confusing for not only myself, but others to understand where the overlap is there. And then I have a follow-up question about some of the impacts related to climate change and development. But yeah, just trying to understand what our role is here in terms of enforcement at public health.
Thanks, Councillor Cratchit. Director McDonald?
Thank you, Mayor. Through you to the councillor. Thank you very much for your question. So the interrelationship with licensing and bylaw standards and municipal law enforcement, specifically property standards, is that formerly our PHIs and now municipal law enforcement officer that's employed by our office and works closely with our colleagues in municipal law enforcement property standards. Often we find, and there's a variable mix of pest control complaints. Often there'll be complaints that are specific to a private residence, private property. We also see other complaints that are regarding tenancies, multiple tenancies, landlord-tenant relationships. And certainly, depending on the investigation that occurs, often we see that property standards are at the root of much of the concerns with pest control. And so our staff would work with the individual complainant. If it's in a tenancy scenario, we would be in contact with the property owner, property management group to ensure that the proper treatments and action is being taken in an expeditious way in order to reach a resolve for the tenant. Often these complaints and the treatments, pests are very resilient. It can take a good deal of time to resolve some of these complaints and concerns in the presence of pests. And so we do work very closely with municipal law enforcement. If we reach an impasse, for example, in a scenario involving a property owner, property management group, we can order treatments and apply those to their property taxes. If we're seeing even more impasse and difficulty, we can work with municipal law enforcement as they would be the issuer of any POA charges under the municipal bylaws concerning property standards. That's sort of a high-level view of how we work with municipal law enforcement as it concerns pests.
Thanks, Director McDonald. Councillor Cratchit?
Yeah, thank you very much for that. You spoke in the singular there about an inspector, right? So I guess my follow-up question to that, and thank you for the explanation, is what we're noticing are two changes. We're noticing climate change impacts, which means that for much of our natural environment, that means that plant species, pests are around a lot more than they may have been otherwise. So there's an increase in pests being around more months of the year, but also as development increases and changes the topography of the downtown core especially, we're seeing a lot of unsettling of pests. Pests have been basically hanging out in certain areas for some time, and we were telling them to exit the area and hang out somewhere else, and so they are. That recirculation of pests, including the changes to climate, are going to mean that in future years, even this year, we're going to see a dramatic increase to pests to the downtown core. How are we scaling up for that? Based on the budget, you've got a very small amount allocated to this. How are we going to scale up in the coming years for this coming sort of pest wave?
Director McDonald?
Yeah. Through the mayor, thank you very much, Councillor, and both excellent questions. Totally in agreement. Both of those conditions will contribute to the presence of pests. Urban environments, this is a struggle across all urban environments here in Canada, North America, as you're aware. And so we see certain types of pests that sort of predominate. Certainly in terms of scaling up, we continue to have conversations with our colleagues in municipal law enforcement. I know that their safe apartment rental program within property standards is one area we're looking at in terms of overall increasing capacity to deal with pests, particularly in those types of settings where we're seeing a relationship between a property owner, property operator, and a tenant. And so they have proposed increased capacity within that program, we would work with them to cross-train them. I'll highlight that public health inspectors aren't uniquely trained in pest control. It's not something that they go through school for. It's acquired skill and knowledge. But our commitment to municipal law enforcement is, as we see some transition in the ability of that program when it comes online, to be able to assist more people and really highlights the scale and scope issues that you've highlighted well.
Thanks, Director McDonald. Councillor Kretsch, I have a couple more speakers, so maybe I'll have them speak, and then if you have further questions, we'll wait for them to finish. Okay?
I have no further questions. That's it for me. Thanks so much.
Okay, thank you, Councillor Kretsch. Councillor Wang, please.
Thank you. Mayor, I'm really happy that Councillor Kretsch addressed slide 9 where talked about 175% higher in lower income neighborhoods. So I do want to again also flag that as something that I'm intensely interested in learning more about. And I do hear Dr. Richardson say that June will hear more about that. I have several questions about what I didn't hear. In slide 7, we talked about seniors being the highest in recorded history, now outpacing, the population of seniors is now outpacing those of younger populations. What are we doing about seniors? And through you, Chair, through you, Mayor.
Thanks, Councillor Wang. Dr. Richardson?
Through you, Mayor. So when it comes to public health programming, it's true that we tend to be focused on the other end of the spectrum, the age spectrum. We tend to be focused in areas that are around healthy growth and development, as you heard Jen speak about. We don't have a specific program that targets seniors as part of our programming. It's not included in the standards as well, in terms of a particular area. And so generally where we tend to intersect is where other parts of our programming would have an impact on seniors. So there's nothing I can point to that in particular is focused in that way, but it would be a part of different programs that we do.
Okay. Supplemental to that then.
Sure.
Looking at your funding slides, I don't see Ministry of Seniors and Accessibility as one of any of those funding sources. Do we go after any funding in that ministry at all?
Through you, Mayor. So we go after any funding that we can to see that aligns with our programming in order to enrich it. And we often speak with different parts of the ministries, but generally focused around MCCSS, Ministry of Health in terms of funding sources. Are working now with Ontario Health to look at what funding sources might be there. So that isn't a particular area that comes up for us from a funding perspective. We do collaborate with them, though, on things that relate to retirement homes, long-term care homes, particularly in the area of infectious diseases and immunization.
Okay. All right, thank you. Switching topics then, through you, Mayor. When I look at slides 36, 38, 39, which is around climate adaptation and climate as a priority, there is a rise of respiratory issues. I do note that those in my ward are very close to industrial areas. So I perhaps through you, Mayor, to Director McDonald, how are we attacking some of the challenges with respiratory issues or identified challenges with those residential communities that are adjacent to industrial neighborhoods?
Okay. Through the Mayor, thank you, Councillor Wang, for your question. So you don't see air quality uniquely tweaked out in terms of the climate impacts priorities because air quality is impacted by more than just climate. Clearly we have emitters, clearly we have transboundary pollution, clearly we have automobile use, for example. And so our air quality and climate cluster, which as you know is a very small group of people headed up in Matt Lawson's area in health hazards and vector-borne diseases, continues to work across the community with various groups, including Clean Air Hamilton, as well as NGO partners like Environment Hamilton, for example, to raise the specter of the importance of clean air in our community. We're also working very closely with our counterparts at the Ministry of the Environment, Conservation and Parks as it concerns public reporting. And we interface with this committee when there are such things as reports to the Spills Action Center, for example. So beyond that, the three priorities that we've identified here in terms of vector-borne diseases, extreme heat and health, and emergency management don't uniquely touch on air quality as you're describing it.
Councillor Wang?
Mayor, I'm just mindful that COPD is on the rise as well, and especially in those lower income neighborhoods, and especially if we're drawing a line back to slide 7, which talks about 175% in lower income neighborhoods. Just wanted to just put a finer point on that. My last question relates to your last couple of slides around funding. Perhaps you could dig a little bit deeper and just expand on what are the fees and general. What does that mean? What's included in that through you, Mayor?
Dr. Richardson?
So in that particular area, those by and large represent the fees that we collect that support things like food safety inspections or other inspections that we do come into those areas. Yeah.
So then supplementally, it's not necessarily some place where we can look at to increase those fees at all?
Through you, Mayor. So each year as we do the user fee report, which you'll have seen and approved already at committee at GIC, we do go through a process, as does the whole of the city, looking at, what is a reasonable rate of increase on fees. And you'll know that many of them have targeted doing 100% recuperation of cost related to them. And for the ones that we look after, we've done those exercises. We look at, how far up can they be taken? Where should they go to? What's fair in terms of, often we're bringing a community-wide benefit to a particular business. And so it's, trying to balance those two things. Where's the community benefit versus that, things that are actually within the control of the particular business. The other thing is looking at the ability of that particular business to bear fees. So if you think of residential care facilities, they pay a lot of the weight through fees, but we're also subsidizing them to provide care. So, it doesn't make a lot of sense, or, it's a difficult business. We're really, focusing on keeping people housed through those facilities. Similarly, for food premises, for example, which make up a huge amount of our fees, where, the industry has been through very, very difficult times. And we're really right up there when we're talking about balancing to public good versus the place in particular. And so saying, probably best to increase along with inflation rather than to be looking to bring those right up to 100%. Okay. So that's the exercise we go through, and we did go through again this year when you saw that user fee report.
Okay, thank you. My last question, also talking about funding then, is when we look at slide 44 and it's all the bar charts, and just as Dr. Richardson has already identified, the city levy portion is increasing, where we see provincial funding is actually staying in and around the same. As we're moving forward and we're seeing that city levy portion is getting larger, how are we having the conversation corporation-wide about the business impacts of how important public health is to this levy? Essentially, I'm trying to understand, how are we having that conversation around return on investment? How are we having that conversation around what are the key performance indicators for every dollar in is X amount of dollars saved in other places in the organization? How does that factor into potentially budgets moving forward? Through you, Mayor.
Thanks, Councillor Wang. Dr. Richardson?
So through you, Mayor, we've done some of those analyses on issue-by-issue basis. So there's a few years ago, there's a really neat piece of work that was done actually around climate change, just before this became as big as it is for the city, where we brought in an economist to actually do all of those kinds of calculations and showed, this is what we can expect in terms of business growth related to climate-related businesses. This is what we can expect in terms of job growth. This is what we can expect in terms of offsetting other impacts. So we've tended to do it on specific issues. We did some of this around LRT when it came to health impacts and those sorts of things. I wouldn't say that we tend to do it globally as we go forward. I'm just noticing Grace is up at the back. Just want to double check if she has anything she wants to add around that. No. Issue by issue.
Okay. So, Mayor, I think that this is also in line with some of the types of conversations we've been having around gender-based budgeting, carbon-based budgeting. I think that as, again, trying to really put a point on the idea that lower income households are negatively impacted by our decisions. So how do we end up making fine, fiscal, prudent decisions with all of these lenses in place, all of them so that we can show to our residents that we are being fine fiscal managers by looking at it from all of these different lenses. So those are some of the questions that I'd like to dig a little bit deeper in afterwards. Thank you.
Okay, thank you, Councillor Wang. I do have you, Councillor Jackson, Councillor Nan first, and then Councillor Jackson. Councillor Nan, please.
Thank you, through you, Mayor, and most of my questions have already been asked. I just wanted to drill in on the report that's coming in June. Will that also unveil kind of the trends that we're seeing as it relates to, if we're looking at a small program area like pest control, like health inspection around pest issues in apartments and in homes? Is that trend data something we'll see in June, or is that data available through the program otherwise?
Through the
Director
Mayor.
McDonald?
Thank you very much, Councillor Nam, for the question. I can certainly take it away and talk to Dr. Richardson about its appropriateness inclusion in the report in June, or we could follow up offline specific to pest control to give you a sense of sort of year over year what we're seeing. As you will appreciate, during the peak period of the pandemic response, we were not performing pest control inspections, so there will be some dormant years there. But in terms of pre-pandemic and more recently September through this year, we can certainly provide that.
Thank you. Through you, Mayor, I think it's really important for us to get a sight line on it, especially with the picking up of the apartment rental program and bylaw regime and a new housing-focused MLE team, and the understanding that pest control is likely to move into that housing bylaw team, just to get a sense of, what is the scale of the magnitude, as we hear from our residents pretty regularly that the bed bug situation is getting really intense, not only in folks' living quarters, but also in public spaces as well. So I think as much as we can get a sight line to that and figure out what else we need to do, the better. Thank you.
Thanks, Councillor Nan. Councillor Jackson, please.
Thanks, Mayor Horvath. Good morning. Thanks, Dr. Richardson, for you and your entire professional, outstanding team for the presentation today. 3 quick questions. On your graphics, it showed, I think, lung disease is on the rise. I remember 40 years ago when Dr. Goodyear was upon us and bringing strong advocacy against tobacco smoke, secondhand smoke, all the legislation and bylaws that came into place. And so fast forward to now, I think the smoking population itself is greatly reduced, maybe about 15% of our population. You would know more accurately than me. But is the rise and the concern about lung disease, is that more from a vaping standpoint that's increasing? Is it more the pollution aspect of what we still are dealing with within our city core and with industries? Maybe you can just give me a general synopsis, please, on what your concern is with lung disease. Through you, Mayor Horvath, please.
Thanks, Councillor Jackson. Dr. Richardson?
Yes, thanks, Councillor. I think it's important to note, I'm just going to take you back to slide 10. And if we look at what's improving and what's worsening, chronic COPD, chronic obstructive pulmonary disease, is actually improving. It's not worsening. Respiratory diseases in terms of infections, respiratory virus seasons, those have been worsening when we look at things like COVID-19 and those sorts of things. When you go back up instead to our slide 8 with the overall top 5 leading causes of death, chronic lower respiratory disease is still up there as number 5. One of the things that has happened with all the successes we've had from a tobacco standpoint, where we once had rates of smoking that were more in the 40% range, is that we have seen those diseases start to come down. Things are starting to shift, but it takes that long after something has been addressed in order to begin to reduce those things. So as we carry forward, tobacco is still on our radar. We still want to have a strong focus there because we can do more. It is still driving some of those things, and you can make a difference even late in somebody's life if they do stop smoking. So if you have somebody who's older and is at risk for heart disease, if they stop smoking, you can improve their health status by reducing those smoking rates. And similarly, we are concerned about teens and young adults and vaping, and we don't want to see a repeat of what we saw with tobacco smoke happen with vaping. When it comes to industrial sources of pollution and air pollution in Hamilton in general, air pollution has improved There has been significant improvements. That said, there are still areas where we can do more. And we've talked last year about, how can business continue to work with the Ministry of Environment, continue to bring down rates of chemicals that are being released into the air? Are there specific ones of concern? And we're aware of some work that's gone on with this community and with the University of Toronto around those things, and expect that report to come soon. So I would say on each of those, we're continuing to do work. They're still of concern to us. We're glad to see that there is some impact on those trends as we go forward, and there's still more work to do. So I'm just going to turn to Kevin, because I've said a lot, and just make sure if there's anything he wants to add.
Through the mayor, thank you, Dr. Richardson. I think fairly comprehensive. Just to the question, I think, Councillor Jackson, it's a conflation of all those things to varying degrees. And so, as Dr. Richard points out so well, tobacco control, a longstanding public health issue of concern, has a comprehensive approach and has been funded at a rate that has yielded success. And so we continue to monitor sort of what's going on within that particular market. The industry itself is always adapting and introducing new products. You see in the correspondence today, there's an issue of concern as it concerns nicotine pouches, for example. And so in that regard, I think continued surveillance, continued work, and how we can marshal the community around some of these issues is really important.
Thank you, Dr. Richardson and Director McDonald, for your thorough, reassuring words. Second question, Mayor Horwath, I noticed on the graphic an increase in syphilis. Is there, in your data, Dr. Richardson, is there concern about an increased amount of unprotected sex and or infections that are occurring by irresponsibility? Maybe just give me a synopsis to understand what's happening there. Through you, Mayor Horwath, please.
Thanks, Councillor Jackson. Dr. Richardson, please.
I'm actually going to turn to Dr. Brendan Liu to address this one. Syphilis has been a significant concern. We're not alone here in seeing these increases. We see them across the country. But I'll turn to Dr. Liu to give you some details.
Dr. Liu, please go ahead.
So through the mayor to the councillor, so syphilis is definitely an infection that is of focus and concern for us, that we've noticed this trend of increasing. As Dr. Richardson has observed, we're not alone in this. This is something that has been seen across the province and in fact, across the country. And there's been a significant rise, particularly across the prairie provinces, over the last 5 to 7 years. And that trend we're now starting to see happen in Ontario. In terms of the people that seem to be at the highest risk of these infections occurring, it does occur through sexual transmission. We still see that the male population, particularly those who are gay, bisexual, and men who have sex with men, are at the highest risk of these infections occurring. But we are also starting to see an increase in these infections occurring amongst females and women of childbearing age. And so this is of particular concern because syphilis is also an infection that can be transmitted to an infant in the form of congenital syphilis. So certainly a trend that we're very attuned to. We're looking to engage with particularly partners in the healthcare community around how can we increase our rates of diagnosis and treatment of syphilis, and it's definitely an area that our sexual health team and our infectious disease program will continue to work and focus on.
Thank you, Associate MOH Dr. Liu. Much appreciated. It's on your radar. Good to hear. Last question, Mayor Horwath, if I could ask Dr. Richardson, I'm sure I'm not alone. I just need to understand what's happening, Dr. Richardson, with the Mandatory Immunization School Pupils Act. I'm sure I'm not alone. I'm getting some emails, some phone calls, and I'm trying to stay out of the deliberations because I thought it was mostly at the school board level. But is there something from our end that, as a member of still Board of Health, that I should be aware of, that to understand with some of the publicity that's been generated recently? And that's my last question, Mayor Horwath, please.
Councillor Jackson, that's an item on the agenda further down, item 9.1, which is a consent item. So if you would like to pull that consent item at the time for discussion, that would be proper, but I think that's not what's on the table right now. It's a separate item, 9.1. Okay?
That's fine, Mayor Horwath. Keep me down for later. Thank you.
Okay, thank you. Okay, we have now Councillor McMeekin. Please go ahead.
Thank you, Your Worship. Dr. Richardson, good morning. How are you?
Good, thanks.
Good. I'm fascinated by the discussion about pharmacare, universal pharmacare. And I'm linking it to what you were saying about blood pressure, diabetes, heart disease, cancer, you know, some of the predominant killers, age expectancy, code red, all that sort of stuff. I'd be interested in your comments. How are we coming with universal pharmacare, and what kind of impact might it have on the kinds of issues that you're raising with us today?
Can I just suggest actually a report back on something like that, Councillor McMeekin? It's not really part of this report, and giving staff the chance to maybe put some thought around that might be
Sure, if that's
the
what
better
you want
thing
to do, Madam Mayor, that's fine with me. Yep.
Dr. Richardson, if you want to address it, that's your prerogative. I mean, I'm happy to. I think we're all happy to hear. I think it's a really good point, but
Of course, yep.
it might need a little bit more time.
I'll yield to the mayor if you're uncomfortable answering that.
Through you, Mayor, I think, you know, pharmacare is a really important piece, and I'll tell you that I was just about to answer the question with, I haven't had an in-depth look at it since before the pandemic, Councillor. I think what we did see then was very much from an economic standpoint that pharmacare made sense, that essentially it would bring drug costs down further, and that would be good for people, for individuals, in terms of the high costs that medication can have, and it would be good for business as well from the standpoint of the costs that they bear. So that's about as extensive as my knowledge is at this point, without going back to see what's been done in the interim over the past 3 years and to see if there's more. And I think it's something that is worthy of us bringing back an information report on that subject.
Okay, if you take a peek at that, I'd appreciate it, because a lot of talk, yeah, you know, we're good at saying what's broken. We're not always as good at how we're going to fix it. And I think the pharmacare issue was one that keeps coming up. Polls show it's near the top of you know, our social population.
Did you want to put a motion at the appropriate time, Councillor McMeekin?
No, I take the officer of health at her word. I think she'll take a look at it and bring it back.
Clerks would prefer a motion so we can keep it on. It's
I'll move we
easier.
do what the medical officer of health suggests she was willing to do.
An information report?
Yeah.
Okay, thank you.
Can I proceed?
Yes, absolutely.
Or do you want to vote on that?
I'm sorry? You want to put that motion now? That's fine. I move an information report be brought back for on pharmacare. That's moved by Councillor McMeekin and seconded by Councillor Maureen Wilson. We'll take a quick vote on that, folks.
Thumbs up.
Is there any further discussion on that? So we have the motion on the floor? Seeing none, okay.
Councillor Francis, don't have your vote. Thank you.
But you don't have your, we have your thumb, thank you. And that carries 13-0. Thanks very much, Councillor McMeekin. Appreciate that. Please go ahead.
Okay. The second, specifically to something you referenced about dental care, urgent dental care needs for kids. You had also mentioned that there's a provincial program that funds dental care for seniors. How is that working? And what's the situation with kids now? We hear a lot about kids' dental care as well.
Through you, Mayor, perhaps I'll begin and then turn it over to Jennifer Vickers-Manson. It's important to note for us here in Hamilton, we're fortunate we have dental care available right across the age groups. So Healthy Smiles Ontario is the program that serves kids up to the age of 18 who are, and is provincially funded, and we do part of the administration of that. In Hamilton as well, for a very long time, we have actually had a municipal treatment program that has filled the gap at various times for various groups, but always for adults who are of low income. And that's provided directly 100% funded by the municipality. We did notice as we went through this year, and I forgot to say this during the presentation, but it's there in the report, which is that there were some programs and services that when we went through the criteria on the funding rules, if you will, from the province that could go into that ASP&B, and so we have moved that in, even though it still stays 100% locally funded. And then there's the Ontario Seniors Dental Care Program that is funded for those who are over the age of 65, and it is provided both directly by us and by others. So we're fortunate to have that whole spectrum. We do know that nationally, of course, there is a federal dental care program rolling out. We don't quite know exactly where that's going to land. So right now, those are the ones that we're going to speak to, and I'll turn it over to Jen.
Director Vickers-Manson, please.
Thank you, and through you, Mayor, to the councillor. Elizabeth, you did a really good job. I don't really have anything else to add except for to highlight that our Ontario Seniors Dental Care Program has some eligibility criteria, which is income-based and for seniors 65 years of age plus.
If I could, Mayor, I'm just wondering, Jen, if you could speak to sort of where we're at with waiting lists and what's happened post-pandemic for those different age groups and that sort of thing.
Perfect, thank you. Through you, Mayor, to the councillor. So you'll recall we brought forward a report around our Ontario Seniors Dental Care Program. We've talked about that program at this committee many times. And our wait for services is about 4 to 6 months and pushing beyond that. And I will have highlighted for you in the past that we triage services for acute dental issues first when our wait times are at that length. And then I will remind you that we are in the middle of a build of a clinic on Upper James that will expand our Ontario Seniors Dental Care program by 2 operatories daily. And so that amounts to about 60 new patients, 60 appointments per week. And the opening for that clinic is set at the end of Q1 2024. So we're really looking forward to opening and providing additional services to help shorten the wait times that seniors are experiencing in our community.
I might say as well, just on the children's front, as we're looking at opening everything back up again post-pandemic, one of the areas of focus that we had was on children as well, and the work we do with children in our community. So we do the screening to see if they're eligible for care, to encourage anybody who doesn't have insurance, meets those eligibility criteria for Healthy Smiles Ontario, to get on board, to get in the program and get moving through, and to follow up any kids that are still struggling. We do know that there is an issue around anesthetics for children and their dental care, in that the Healthy Smiles Ontario program doesn't fund that. And so Jen has been working diligently with different community partners to see about, can anybody help close this gap? Because it's a significant gap for parents whose children who do have, unfortunately, significant issues and need care. So it's one of the challenges we have. But as you saw in the stats, our dental dental wellness levels for our kids are actually a little better than they were, and we've done a lot of work concentrated with those kids to make sure that we've addressed those post-pandemic.
Thanks for that comprehensive answer, Your Worship. My one final comment, I just want to thank Dr. Richardson and her team for their presentation. I'm always pleased to hear from the good doctor and her team. They always share some really cogent and important stuff with us. So thank you, Elizabeth. Take care.
Thanks, Councillor McMeekin. Councillor Beattie, please go ahead.
Thank you, Mayor, and through you, thank you, Dr. Richardson, and your team for a really wonderful report today. Mayor, it's not really a comment, not really a question, something of maybe a request. If I could just addressing two of the issues that were raised today. First, with regards to vaping. Members of committee will recall our Ward 10 Youth Council wrote to you, Mayor, and Council last year to express their concerns and to urge Council to take action. And so I would offer, Doctor, that you please keep us in mind as your strategy unfolds. And in particular, just want to again make note that there's big buy-in from youth in the community with regards to the vaping issue. We just have to make sure that we're speaking the language that they understand. And someone who has 4 youth at home, ages 16 to 20, I don't always understand them. But if we can crack that code and speak to them in a language that they understand, they'll be able to disseminate this information better to their peers and their colleagues. So I would ask that you just continue down that line. And again, please keep members of council involved and specifically if there's anything youth related that could be sent as the strategy continues to unfold. I know that the Youth Council in Stoney Creek could be very appreciative. Second issue, Mayor, on the pest control file, particularly rodent, not just a urban issue. I can't speak for all of my suburban colleagues, but it's very front of mind in high growth suburban locations such as the communities that I represent. So again, I'm just asking that in addition to the issues outlined by my urban colleagues, please keep us in mind as that strategy unfolds. It is really a citywide issue, but just wanted to make sure that it didn't get lost. If there's communication coming back to my urban colleagues, I'd just like to be included in that little bit as well. Thank you, Mayor.
Thank you, Councillor Beattie. I don't see anybody further on the speakers list, and so can I have the motion to receive the presentation, moved by Councillor Nance, seconded by Councillor McMeekin. Can we have the vote on that, please? That carries 12-0. Thanks very much. There is a confidential item that's part of this overall report. And so we can either hold the report till after the private and confidential if members see a need to go into the private and confidential. I just need a sense of if you want to go into private and confidential or not. I don't see anybody around the council chamber wanting to do the private and confidential. Okay, so that's good. When it comes to that, we'll just approve that report. So we'll now then have the report. Can I have a mover and seconder for the report? Moved by Councillor Wang, seconded by Councillor Pauls. Any particular discussion? Oh, Councillor Wang, please.
Thank you. Mayor, the recommendation in Part B says to submit the actual budget and the actual plan to the ministry. I just wanted to understand, is there an opportunity to submit a budget ask that is above and beyond what the ministry mandated funding allocations are? Similar to how we have business cases that are submitted to our council that are above and beyond block funding. Just wanted to know if that was possible.
Thanks, Councillor Wang. Dr. Richardson, please.
Through you, Mayor, so it's a good question. The ministry has an approach where they do work with us to help us understand what it is that we can ask for in terms of extra funding and those sorts of things. So over time, there's been things to put in for Ontario Seniors Dental, for example, for capital improvements or for increased programming, because they know there's pressures in the programs, not just here, but across the province. And so they generally outline those for us as we go through the process, and then we see what it is that we have that might fit with the needs. Certainly some of the things that they're looking to fund might fit with more northern communities' needs, as an example. And so as they go forward right now, we've had, of course, extensive opportunities to ask for funding for COVID-19 vaccination, and we continue to advocate for, additional funding to increase levels overall, continue to ask for funding to address these pressures. But their actual template that they've given us to fill out has made clear where they're investing right now, and those are around the mergers for our colleagues. There isn't anything in particular that they've opened the door on about what they might accept for additional business cases that would apply to us. We have, though, made sure that we have submitted everything that falls under the paradigm of the annual service plan and budget and those standards, so that it's there and the degree to which additional funding would be appreciated. So those are already included in what is there, and if there are any other opportunities to apply for additional funding, we would bring them back and look to apply for them.
Councillor Wang?
Mayor, we declared an emergency around mental health, opioid addiction, and homelessness. I hear Dr. Richardson. I hear what she has just said, and that we are absolutely following what the normal course of action would look like. I wonder for, say, next year when we have to go back and ask the province again for funding, is there an opportunity for us to be a little more proactive? Just knowing full well that we've always followed along with the rules, essentially I'm asking, is there an opportunity for us to be not a cowboy, but definitely a little more aggressive with asking for funding?
Thanks, Councillor Wang. You will know that there are provincial bodies of public health agencies that work really hard to get the government to fund more items, and I don't know if that's helpful. Dr. Richardson?
Through you, Mayor, yes, there is the Association of Local Public Health Agencies, and Councillor Wilson sits on the executive right now. As part of that, doing that advocacy work, I sit on the Council of Medical Officers, so we do those things. I did just want to note, what we have included in the annual service plan for this year does include the council-referred items. So the evaluation piece for CTSs, the air quality piece has been included. So anything that is relevant to those, we do go ahead and include those. So I would say the best way to approach it is to take those things through, the annual process, look at it from the standpoint of what we're developing for both staff business cases and council referred items that could be considered through the usual budget process, and then we would look at aligning those with the annual service plan and budget as well.
My last question, Mayor, has to do with something that may or may not touch this public health committee. The hospitals have come and asked us for $462 million. How does that fit in with this? Is there a need? Is there a touch point? Do we have the ability to advocate specifically through ALPHA, through Dr. Richardson's Chief Medical Officers Association? I don't know what that looks like. I just wanted to ask for some clarification there.
Sure, absolutely. Dr. Richardson?
Through you, Madam Mayor. So when it comes to issues of health care, because there are different parts of the ministry, we relate to the public health part, the Office of the Chief MOH, Population Health, Public Health, and the hospitals are working with a very different part of the ministry. We don't tend to get involved in the financial issues that are there. We do, of course, on a regular basis, collaborate in the community around issues that are of mutual concern, and we're doing that all the time. The other thing is we do have the Greater Hamilton Health Network, where we sit around the table, and eventually, those Ontario health teams are meant to really bring together all of the players, and we would be there as well as public health sitting at that table as we are now and talk about those things. So the best route in is probably through the Greater Hamilton Health Network rather than through public health per se.
Thank you, Mayor. Those are all my questions.
Thanks, Councillor Wang. And you'll know also that the provincial Ontario Big City Mayors and other organizations are seized with this issue as well. Thanks very much. I don't see any further speakers on the list on the report, so we've had it moved and seconded. Can we go to the vote, please? That carries 12-0. Thanks very much. We're now on to consent items. May I have a mover and seconder to put item 9.1 on the floor, please? Moved by Councillor Gassar, seconded by Councillor Nan. I think this is the one you were interested in, Councillor Jackson, so please go ahead.
Thanks, Mayor Horvath. Dr. Richardson, just a basic question to repeat what I asked about a half hour ago. Just a basic question. This is an information report on the the Immunization School Pupils Act. It's just information. So forgive me, I'm just going to be a little cheeky. Did you just put this in front of us because, well, Councillor Jackson, probably it's been many months since you've seen this, and I just want to refresh your memory. Is there, because I see no recommendation, is there anything changing that I should be aware of as a member of Public Health Committee and a member of Council? Can you just kind of in a cursory way help me understand, you've got it here, why is it here, and is there anything that has changed from what's been happening throughout COVID and since COVID? That's my basic question, Mayor Horvath. Thank you.
Thanks, Councillor Jackson. Dr. Richardson, please.
It's for you, Mayor. So you're absolutely right on the first count, Councillor Jackson, which is that we had not come to talk about immunizations, and particularly the Immunization of School Pupils Act, for some time with this council, and indeed since you've been in place as the group that you are today, we have not been enforcing this act and moving forward in those ways. And so we thought it was very important as we do step through it to understand a little bit more about immunization statistics and where we sit in this community right now, as well as understand what the roles are. So I'll turn it over to Jordan to talk a little bit more about the where we're at around this legislation and our immunization programs more broadly. I think one of the things I always want to say when we come down to this piece of legislation, what we're trying to do first and foremost is help kids get vaccinated in this community. And it is one of the best ways that we have at hand to prevent some very serious diseases. And so that is where we are first and foremost focused. So while sometimes we do end up in this part of the work, which is into the enforcement part of it, that's not where the majority of our time and effort is spent. But I'll turn it over to Jordan.
I'm going to ask again for some order in this council chambers. Now, I've warned a couple of times, and I would like to have some order in this chamber. So we'll now go on to any further clarification, Councillor Jackson, that you might have.
I just didn't know if Director Jordan Walker had anything further to add from Dr. Richardson.
I apologize.
Otherwise, I was very satisfied with Dr. Richardson's response, but in case Director Walker had anything further.
So through the mayor to the councillor, Jordan Walker, Director of Communicable Disease Control. So yes, the report before you, as you're probably aware, is not a new program. The Immunization of School Pupils Act is a piece of legislation that has been in place for a number of decades at this point in Ontario. However, and you rightly pointed out, during COVID, things had changed for us. So while we had been, just to back up, I guess first to say the Act requires all medical officers of health to have up-to-date immunization records or exemptions on file for school-age children attending school within their jurisdiction. And so there's a number of pieces that go into that. As Dr. Richardson mentioned, this is one element of our program. So both from promoting and providing advice about the vaccines and about immunizations, and offering certain vaccinations in certain circumstances, such as in our grade 7 clinics, as well as offering, vaccination catch-up in the community for equity-deserving populations and those who may not have a primary care provider. There are a number of programs that we implement to try to increase these vaccination rates. However, during the COVID-19 pandemic, as a number of our resources were redeployed to respond to that pandemic, as well as the impacts that pandemic had on primary care, it really did present some barriers to the public in terms of obtaining those immunization programs and having access to those immunization programs. So coming through that, we have been, as you'll know, restarting a number of our programs over the last number of years. So we had restarted doing our school-age clinics starting in the fall of 2022. High school clinics began in early 2023, as well as resuming those screening of individuals under the Immunization of School Pupils Act. What we had not done certainly during the pandemic and had not restarted last year when we resumed the screening, was the enforcement of the Immunization of School Pupils Act. So that's the element of the program that we're looking to move forward with now to help to achieve really to get those vaccination rates that are so critical for protecting our community back to the levels that we had seen pre-pandemic.
Director Walker, yeah, Mayor Horvath, thanks for your indulgence. I just thought even for public consumption and the record, the statements that our two professionals have made, at least now is out there for people to digest. Thanks, Mayor Horvath.
Thanks, Councillor Jackson. Councillor Danko.
Thank you, Mayor. I actually have my son's immunization order for suspension right here. He's in the 2008 cohort. So just first of all, I really appreciate all the effort that goes into public health and making sure that parents are aware of where there might be an unintentional lapse in their vaccinations for their children. I note in the report it says that we are sending notices and keeping track of vaccinations for 80,000 students, which is remarkable. I'm sure no small level of effort. So my question is, how is that coordinated between the City of Hamilton Public Health, the individual private doctors' offices, and the province, the Ministry of Health?
Director Walker?
Through the mayor. Thank you for the question. So when it comes to these vaccination records, really these are kept, they are maintained by the public health unit, so through the medical officer of health. In a database, it is a ministry database that these records are collected. But when an individual goes to, say, their family physician to obtain one of these vaccinations, unlike something like COVID, which is updated immediately into the system, this uses a different database, different system, and so it's not immediately recorded or captured in that way. And so it does fall back upon the parents and guardians to report those vaccinations that their children have received to public health, so that we are able to enter them and track them in this way, because there is no connection that does that from us back to the physician's offices.
Councillor Danko?
Thank you. And a follow-up question on that is on the in-school vaccination clinics that was mentioned briefly in Councillor Jackson's question. If we're going to refocus on that, kind of the same question, how is that information coordinated between if a vaccination is provided in an in-school clinic, is reported to the doctor's office, and kept track of in public health?
Director Walker?
Through the mayor. So when we're doing those clinics in the school community, that's actually perhaps one of the most convenient ways to do them, because we're able to actually track and record those immediately at that time. So it really avoids that issue of needing to report them back. That's why we've certainly, as we've been working to try to get through, to get through sort of the backlog, or get through some of the individuals who may have missed vaccinations during the COVID-19 pandemic, we've really been trying to offer and increase the number of offering of clinics, particularly in high schools, for instance, to do that catch up, because it does afford that convenient opportunity, and it avoids that reporting piece as well. We're able to capture it all at once.
Excellent. Thank you, Mayor. Those are all the questions I had. And again, just really appreciate the efforts that it takes to make sure that all this work is coordinated and that all students have the vaccinations that they need to be healthy. Thank you.
Thank you, Councillor Danko. I don't see any further speakers on this item 9.1. So it was on the table for discussion. We'll have a vote then on the receiving of this information report. That carries 12-0. Thanks very much. There is no further business on the agenda for this morning. And so we will then go to the motion on adjournment. Moved by Councillor Cassar. Oh, I'm sorry. Did I miss something?
I believe I have missed something. It's my fault. We do have the outstanding business list amendments that I think I missed in your roadmap.
Oh, they did. Okay, they're not, yes, you're right, they're not in the roadmap, but that's okay.
They're on page 5, actually.
Or are they on page 5? Oh, so I skipped ahead. All righty then. Aha. Outstanding business list. Is there any discussion on the amendments to the outstanding business list? Report on recommendations for Board of Health Advisory Committee, OBL item 21E23C, added February 8th and completed January 15th, 2024. Councillor Wilson? Moving? Seconding, Councillor Wang? Any discussion? Seeing none, we'll have that vote. Apologies, colleagues. I did, I jumped the gun. That carries 11-0. Now we'll go to the adjournment. And that was Councillor Kassar and Councillor Wang. Can we have the vote, please? Yes, Kassar and Wang. And that carries 11-0. Thanks very much, everybody. Enjoy the rest of your Monday and the rest of your week.